you had mentioned you didn't get to see Dr. Padula's lecture, but it was so good. And he really talked a lot about just focal binding, where we need to move out into the periphery more and not be so centrally fixated with our therapy, really. So this question is, during Dr. Padula's lecture, he talked about how VMS is more of a visual processing deficit. You seem to classify it as a vestibular issue. I'm guessing they're related, as vision and vestibular are so tightly linked, but can you go more into what you think the causes of and the appropriate treatment for VMS is?
What I know is that in patients who have visual motion sensitivity, there is an interactive effect. It's visual and vestibular, and it's a problem generally with people becoming visually dependent because they don't use their vestibular system effectively. So it isn't, I don't think it's only about visual processing. I think it's about the fact that you would normally not be bothered by that stimulus because you would switch to using your vestibular sensation normally. But now, because you are dependent on using your eyes for all of your balance function in this particular issue, then you're much more sensitive to anything that has movement or optokinetic flow or complexity, or when you're just moving your head. So I would just potentially just think about this a little differently. So I think it's an interactive effect. And so I don't think it falls into, I think it's about training somebody to utilize all their sensory inputs appropriately and to also filter the visual system better. So that's kind of how I conceptualize it.